All right, the time is now 8:55. We are getting ready for 9 o'clock medication administration for patient name Shelly Anderson. Date of birth is 5/29/1984. She is allergic to penicillin in room 112, bed 1. Let's take a look at her information. Shelly was diagnosed with pneumonia. She's been having these respiratory issues for 4 days now. Interferes with her ADL and her sleep. She has past medical history of renal insufficiency, hypertension, and coronary artery disease. Let's take a look at her vitals. Her temperature is at 37.2 degrees Celsius. Heart rate is 89 beats per minute. Blood pressure is 133/78. Respiratory rate is 22 beats per minute, a little bit quick. Her oxygen saturation is 94%, which is a little bit low, which is why she has the nasal cannula. She has a pain level of 2, pain with breathing and ambulation. Her labs show that her white blood cell count is 12.3, which is a little bit elevated. So that's why we're probably that's from the pneumonia. Platelet count is 300, which is good. Let's see if she's able to eat. She has had breakfast and she consumed 50% of it orally. So she is not NPO, so oral medication will be okay. So now let's take a look at her medications. We're administering her 9 o'clock medication. The first one is going to be aspirin, 81 milligrams. Here we have aspirin, 81 milligrams, expiring 12/20/30. That's scheduled for 9 o'clock. Route is going to be oral. Let's take a look at the second medication. Diltiazem hydrochloride, 60 milligrams daily. Diltiazem, here we go. Diltiazem, 60 milligrams. Her next medication up is going to be Docusate, 100 milligrams, scheduled for 9 o'clock. Here's her next medication, Docusate, sodium, 100 milligrams, expiring 12/20/30. Next medication is furosemide, that is scheduled for 11 o'clock, so we won't be administering that now. We will move on to the next medication. Her next and last medication is levofloxacin for 500 milligrams. Here's levofloxacin. It is 250 milligrams, so we need 2 of these. So we have 2 levofloxacin tablets for 250 milligrams. Both expire 12/20/30 and 500 milligrams levofloxacin. We are done with our first check. Go back to aspirin. We're going to do our second check now. So patient name is Shelly Anderson. Medication scheduled for 9 a.m. Aspirin, 81 milligrams. Route is going to be oral. Medication expires 12/20/30. So aspirin is a blood thinner medication. Its effects take place in 15 minutes to 2 hours for peak. So with aspirin, we do have to assess the patient for any abnormal bleeding. So this medication requires additional assessment. We'll grab our 2 medication cups right here. And we do have an assessment needed and administer circle right here to separate them so that we can know which ones to assess for later. So this is aspirin, 81 milligrams, assessment needed. Side effects of that medication we will present to the client later. Next medication up, we have diltiazem hydrochloride. Diltiazem hydrochloride, 60 milligrams, expiring 12/20/30. This medication is scheduled for 9 a.m. Route is going to be oral. And this is a 60 milligram tablet for Shelly Anderson. With this medication, we need to hold if her systolic blood pressure is less than 90, diastolic is less than 60, and heart rate is less than 60. Reason being is that it's a blood pressure medication. It's going to lower her blood pressure and her heart rate. So if her heart rate and blood pressure are already low and we give her this medication, it's going to drop too low, which can be dangerous. So this assessment is also needed. Next medication up, we have Docusate. Docusate sodium, 100 milligrams, scheduled for 9 o'clock, expiring 12/20/30. Route is going to be oral, and this is for patient Shelly Anderson. Docusate sodium is going to be a stool softener. We're going to give this medication if the patient is having problems with bowel movement, if she is not able to go, but we are going to assess and see if she's having normal bowel movements. If she is, we're not administering it. And if she is having loose stools already, we are not going to administer it. We're going to assess additionally with this medication. Next medication up, furosemide, that's 411. We are not going to use that one right now. Last medication is levofloxacin for 500 milligrams. So we have 2 tablets, both expire 12/20/30, scheduled for 9 a.m. Route is going to be oral for patient Shelly Anderson. Levofloxacin is a broad spectrum antibiotic meant to stop the replication of bacteria. So this is going to treat her pneumonia. For this one, it's doctor ordered. Her white blood cell count is elevated at 12.3, so we do need to administer this medication. No assessment is needed, but we will educate the patient on the medication once we get there. So we have 3 medications that need assessment: aspirin, diltiazem, and Docusate. And the levofloxacin we are going to administer. Patient does have a penicillin allergy, but we are not administering penicillin, so we will be okay. We are now going to go to the patient's room. Shelly Anderson is staying in room 112, bed 1. We will gather our medications and go over there. Knock, knock.
Hello.
Hi there, my name is Michael. I'm your registered nurse for today. Could I come in?
Yes, please.
Alrighty. So it's now 9 o'clock. We're going to give you your 9 o'clock medications. Before we start or anything, could you please confirm your first and last name for me?
Shelly Anderson.
Shelly Anderson, and your date of birth?
5/29/1984.
Okay, 1 second. Do hand hygiene. And let's go ahead and close these curtains. All right, Shelly, can I please check your wristband?
Sure.
Anderson Shelly, DOB 5/29/1984. Alrighty. All right, Shelly. So we have 4 medications to administer at 9 o'clock today. How are you feeling right now? Are you good?
I'm doing okay.
Are you okay? Are you in a comfortable position right now?
I can sit up.
Yeah. Let's go ahead and scoot you up for your medication. Alrighty. So the first medication I'm going to administer is going to be your aspirin 81 milligram. Do you know what aspirin 81 milligram is for?
No.
Your aspirin 81 milligram is just going to be administered for blood. It's a blood thinner medication. Before I administer it, I just need to ask you a few questions regarding, just to see if it's an appropriate time to give it to you. So first medication, aspirin 81 milligram, expiring 12/20/30 for patient Shelly Anderson, scheduled for 9. Route is going to be oral. So for aspirin, it's a blood thinner. Have you had any abnormal bleeding, say the gums, urine, or stools?
Nope.
Okay, so this one's going to be safe to give right now. We're going to put that in the administration cup. Second medication, oh yeah, for the aspirin, side effects are going to include dizziness, vomiting, nausea. That could take place anywhere from 15 minutes to 2 hours after you take the medication. So, any questions regarding that?
Mm.
Just let us know if any of that does happen.
Alright.
Next medication up, we have diltiazem hydrochloride, 60 milligrams, expiring 12/20/30, scheduled for 9 o'clock. Route is oral for patient Shelly Anderson. Do you know what diltiazem is?
No.
So diltiazem is going to be a blood pressure medication. We're going to give this to you, but we have to make sure that your systolic blood pressure is above 90, your diastolic is below 60, and your heart rate is, or above 60, and your heart rate is above 60. Reason being is it being a high blood or a blood pressure medication. If you take it, it's going to drop your blood pressure and your heart rate down. So we want to make sure your heart rate and your blood pressure isn't already low, because if it gets to too low of a level, it can be dangerous.
Okay, that makes sense.
So before I administer it, can I check your blood pressure?
Yeah, sure.
Right arm okay?
Yeah.
Your blood pressure is 133/80. And I'm going to check your apical pulse for 1 minute. So your apical pulse is 58. That's going to be under the 60 heart rate threshold.
Okay.
So I'm going to have to hold this medication for now and reassess you in maybe an hour to see if we can administer it.
Mm-hmm.
Reason being is we just don't want everything to drop too low because that can be dangerous.
Okay, that makes sense.
So diltiazem is going to be held for now. We will reassess in 1 hour. Next medication you have up is Docusate sodium. Docusate for 100 milligrams, expiring 12/20/30, scheduled for 9 o'clock. Route is going to be oral. Patient is Shelly Anderson. So Docusate sodium is a stool softener.
Mm-hmm.
Have you had normal bowel movements? When was your last bowel movement?
About 2 days ago.
Was it loose or was it firm?
It was firm.
It was firm?
Mm-hmm.
And was it hard to go?
A little bit.
Yeah, and you haven't gone in the past 2 days, right? Okay. So with this, it's a stool softener. It's going to help you go. Side effects could be having runny stools. And if you do get runny stools, we're going to reassess, maybe stop the medication. So let us know if that does occur. But for now, we're going to administer the Docusate.
Okay.
Administer. And the next medication up, furosemide, that's not until 11, so I'll be back at 11 o'clock to administer that.
Okay.
Last medication you have is levofloxacin. Alrighty, so levofloxacin is a broad spectrum antibiotic. This is going to be what's going to help you with your pneumonia. Side effects of this medication could include dizziness, nausea, vomiting. So if any of those occur, do let me know. So with this one, we have levofloxacin, 500 milligrams, scheduled for 9 o'clock, oral, expiring 12/20/30. So this is good to administer. So we're going to give you 2 tablets of this. This is going to help with your pneumonia.
Okay.
So right now, I have 3 medications for you. One is going to be withheld that I'm going to check with you later in about an hour.
Okay.
But we have 3 medications right now. Do you want to take the medication all at once or one by one?
I can do it all at once.
All at once? Okay, and would you like water with that?
Yeah.
Okay. So here you are. That's your medication, and here's the water. Awesome. Thank you very much. Time is now 9:03. Let me go ahead and document that real quick. We took the aspirin at 9:03. Diltiazem is being held for reassessment in 1 hour. Docusate taken at 9:03. Furosemides for 11 o'clock. Levofloxacin taken at 9:03. Okay, Shelly, that's going to do for your medication administration for 9 o'clock. Do you have any questions for me? All right, I'm going to go ahead and put your bed all the way down. Side rails up. Here's your call light. And I'm going to be back in about 15 to 30 minutes to recheck on you to see if you have any abnormal side effects. And I'll be back in an hour to reassess for the diltiazem medication.
Okay.
Alrighty, I'll be back in a bit. Knock, knock.
Hello.
Hi there. Michael, I'm back again.
How's it going?
So it's been about 30 minutes. Have you had any abnormal side effects?
No, I'm doing okay.
No, you're doing good?
Mhm.
All right, I'll be back in 30 minutes or so to recheck for the dental eye exam.
All right.
All right.
Thank you.
Have a good one.
You too.